Hello and welcome to Q Weekly, and welcome to our new time slot. I hope it suits you, just as it suits us. I'm Peter, I'm your host for this evening, and tonight I'll be joined by David and Michael. How are you?
Good to see you, Peter. Hello, Peter. Thank you.
And Tony Keenan, hello, how are you, Tony?
Hi, Peter.
Who worked on the Victorian Gay, Lesbian, Bisexual, Transgender and Intersex Health Action Plan. More on that later. Actually, no, we're going straight into it, actually. Yes. Sorry. Tony, so you are actually the chairperson of the Ministerial Advisory Committee on Gay and Lesbian Health. We really need to shorten these names, don't we?
I know.
So, what is that exactly?
The last government, last Labor government, when they were elected, the Health Minister, John Thwaites, set up a Ministerial Advisory Committee on gay and lesbian health, and it was essentially set up to give him advice on issues affecting the alphabet, gay, lesbian, bisexual, transgender, intersex, and a specific brief was to present a health action plan to him, which we've just finished. It's just been out for consultation, that's back now, and we're aiming to give it to the new Health Minister, Bronwyn Pike, and that should be about February.
Okay. Is it weird having to swap ministers? Is it scary? Or?
Not really. I mean, one big advantage was that the policies were locked in before the election, so the policy commitments will continue. And Bronwyn Pike has a really strong record in the community sector, and we're more than confident she'll be a very good health minister for the queer communities.
Okay. So it really doesn't change from
no.
who does a new minister?
Well, it does. The Ministerial Advisory Committee, as the name says, it's set up to advise that minister. So technically we no longer exist because John's finished, and whether or not Bronwyn sets up another committee, that'll be her decision. But we have to finish off the work, obviously. So the work's been done, it was put out to consultation, it'll be signed off. We're meeting late January to incorporate the recommendations or the feedback we've had from people, and we'll get the final plan up to the new Health Minister.
Okay.
So what was the things coming out of the advisory report?
Yeah, we've had sort of 3 years to work on it. It was pretty hard because...
That long? Really?
Yes.
Wouldn't have been awful if Liberal had got in.
Oh.
He's thrown out the window.
Well, I'm going to be very apolitical.
Not quite. No, they did make certain commitments before the election, but then who doesn't make commitments just before an election? But
exactly.
Yeah, I mean, we don't know what would have happened had there been a change of government. One thing we do know, which we're really pleased with, is that they committed to back the $1 million to set up the Gay and Lesbian Health Unit, which is part of our plan. It's the key recommendation.
with regards to education,
It'll have an ongoing role because hopefully the whole aim of setting up is be there forever. But the initial thing that we're wanting it to do is a range of things. One is to work with healthcare providers. One of the biggest feedback we got from people, two things: bad experiences with healthcare providers, and people saying that they by and large want to access their health services in mainstream services, particularly people in the country areas, that there's some gay and lesbian specific services they want. But by and large, if they want to go to a physiotherapist, they don't want to find a gay and lesbian physiotherapist necessarily. They want to be able to go and...
just down to the bloke on the corner.
That's right.
Yeah.
So part of the first role will be to do education with healthcare providers and with the organisations that educate healthcare providers, like the College of Nursing, the College of General Practitioners.
Yes, well, I understand they've actually taken the research part of your document on board to help formulate their own policies with regard to gay health.
That's right. Both the Australian Medical Association and the College of General Practitioners have incorporated our stuff into their own policies, which is fantastic.
Yeah.
Yeah.
So is this still...
We should just call it queer health from now on. Otherwise, we're getting all these acronyms are going to just drive us insane.
Okay.
Yeah, please don't be
If I say gay too often, all our lesbian partners will call in, and it's just not worth it. So.
Too much. So what, is there still a lot of ingrained homophobia in healthcare?
Yeah, there's overt homophobia, which is probably not that common.
Yeah.
And then there's more subtle forms of homophobia, which is probably more common. But that's not a bad thing just because it's not nice and it's not good to experience. It actually has health impacts because it means that doctors, for example, might not ask the right questions or they might misdiagnose things. And one of the bits of research that we found out was that queer people, for want of a better expression, are often late presenters or they get stuff misdiagnosed. Now,
What do you mean? What's the late?
all right, you might have symptoms from a health problem and you put off going to see a doctor.
Oh, okay.
Or you might go to a doctor and not mention your particular concern because you're embarrassed or you don't want to raise your sexuality.
Oh, I see.
So it's not just homophobia amongst health professionals, not just a bad thing because it's not nice. It actually has impact on people's health.
Well, also the stress factor alone, surely. That's another thing to add on. Like, you're already not well, and then the stress of being treated a certain way or fearing that you'll be treated a certain way is probably more to the point.
Absolutely.
It can add a lot to people's distress.
Absolutely, and there's also just a lack of understanding sometimes about issues that are relevant to queer people. For example, there's a bit of a myth. A lot of doctors think that cervical cancer is not a problem for lesbians.
Why do they think that?
Well, the notion is because women don't have sex with men, that therefore they're not at risk. It's absolute rubbish, and there's no evidence to back that up. So that sort of stuff can be really alarming in terms of the impact that might have on someone's health.
So it's more really from a point of view of just pure ignorance sometimes of
It's a combination of ignorance and stereotyping, subtle homophobia, transgender issues, for example. Lack of knowledge amongst mainstream providers is bordering on zero. I mean, there are a number of doctors who work with the transgender community, but out there in the broader community, very, very little knowledge. And they're quite significant concerns, like issues around prostate cancer for male to female transsexuals, other issues in relation to the long-term impact of being on hormone replacement therapy, issues around bone mineral density, all of those things. Now, I would suspect very few doctors know about that, so it's sort of that sort of education, both on homophobia and attitudes, but also on the actual health issues.
Now, the plan looked at a lot of youth issues.
Yes,
as well.
I was just going to say, because there's also the youth suicide issue, isn't it? Especially country Victoria, for example.
Yeah.
Yeah, there's still a lot of people who don't believe that a lot of youth are killing themselves because of sexuality issues, isn't it?
That's right. I mean, the most alarming issue and the most important issue that we looked at was youth suicide. But that was so urgent, we didn't say, we'll wait 3 years to get a plan to do something about it. We've actually done a fair bit already. There's been $500,000 going to youth suicide initiatives. And one of those picks up on what you mentioned, which is the data collection. There are some studies that show, one study I know shows that queer youth are 4 times more likely to attempt suicide. But there's not a lot of specific data, particularly in Victoria, a lot of anecdotal stuff. So part of that money is going to get better figures on it. But obviously the figures aren't the important thing, it's programs to address and deal with it.
Yes, exactly. Yeah, you can bank count as long as you like, but
Yeah.
get out there and save a life.
So what sort of programs are coming out of this?
There's 2 pilot programs, one up around the Bendigo area, another one out in the eastern suburbs, which is looking at interventions. One of the key things we need to be working with is with schools and with teachers and particularly pupil welfare coordinators.
How open are they to that?
They're open. Again, it's part of a lack of knowledge. And it's also a pretty difficult area. It's, you don't want amateurs dealing with this stuff. I mean, there's some real issues around safety. There was a case a few years ago where a well-meaning youth worker encouraged a kid to come out. Now, that was probably the most dangerous thing she could have done. I mean, Obviously, long term, we think that it's healthy, a
Oh,
whole
of
heap of
course,
ways
yes.
to come
It's a
out.
personal thing, isn't it?
But in a school setting, and as you're just exploring your sexuality, and that's probably the worst possible thing
Oh,
you
wow.
can do. So one of the things you've got to get across is that you have to provide a safe environment for young people. And part of that safety might be to say, look, come out if you want, but in your own time.
Yeah.
And
Announce it at assembly.
you don't announce it in assembly. Yeah.
No, but it's also part. I think also if a school's aware that there's gay students in their student body, and I mean, you can't assume that they're not.
Yeah.
Then the onus is on them to educate the student body
Yeah.
as to how they should be dealing with.
Yeah, I was reading some time ago that some of the youth issues, they're actually trying to get more senior students to take on the role of, for want of a better word, I suppose, mentoring or
Absolutely.
Wow.
working with the younger students, because they found that students have a better way of relating to each other rather than to an adult, which I can understand.
Yeah.
Oh, yeah.
So how does that affect, though, like you're trying to train, I suppose, senior students at all, or?
We wouldn't be that directive about what a particular school does. Having said that, there are a lot of schools doing what they call vertical pastoral care, which means older kids.
Oh, I see.
And that's really about targeting bullying in general.
Yeah.
So, and having older buddies with younger students, that sort of stuff. But the thing that we need to address and the government needs to address, and as part of our recommendations, is around a statewide policy around bullying in schools that says that schools' bullying policies need to specifically address homophobia, and that a school's responsibility is to provide a safe environment for all students. So if you've got queer students, which every school I would imagine would have, part of your bullying policy needs to explicitly address homophobia and say you've got to do something about it.
But isn't it like at the end that each school basically can do what they want? Is that like, don't they have the final say?
No, there's all legal issues now. Like kids are suing their schools and for getting bullied and that sort of thing because they do have a duty of care.
Yeah, well they do. I mean, they definitely do. But yeah, I just remember reading that. You can have all these policies, but at the end of the day, I think the school. I'm not sure, but
No, a school should develop its own bullying policy, and a school is the only body that can do that. But there needs to be a statewide.
Okay, I'm going to have to wind you up at the moment. Come back. We're going to continue this discussion after the break. Hello, welcome back to Q Weekly. We were just having a little discussion there. Thank you for coming back. We're still talking with Tony Keenan from the Ministerial Advisory Committee on Gay and Lesbian Health. Now, I just wanted to clarify that last comment before the break about
About
schools.
bullying.
Yes.
Yeah, look, schools don't have an option that they can allow bullying against queer students. Not a legal option. There's been enough court cases now that have well and truly established the legal obligation on schools to prevent bullying. So I don't see how any school, Christian or otherwise, can argue that they're allowed to allow bullying. Certainly schools will have much more freedom, I guess, around their sexuality education programs.
Well, it shouldn't matter what the subject of the bullying is,
Yeah,
should it?
bullying.
No. Bullying is bullying.
Yeah,
No.
I would hope so.
Yeah.
And just quickly, you want to look at the drugs and alcohol.
Yeah, I guess one of the other issues that came up in the research papers were drug and alcohol issues, and not necessarily an easy issue for the community itself to address. But there's certainly been a number of studies which indicate high levels of drug use. Now,
Surprise.
I'm not disputing
surprising.
it. Well, I mean, you go to
How'd you get
some of
paid
these
that much?
contact websites, where you
Yeah.
fill in your details and everything. They actually ask you, and only on gay websites I've noticed, drug usage,
Really?
safe sex, and there's another one, and you've
Smoking,
got
drinking.
smoking, drink, exactly. And so on a straight site you might get the smoking, drinking, but on a gay website you'll get, do you use drugs? And it's got, you can tick socially, never, or always, sort of thing.
Well, it's part of the
So I quite
Yeah.
agree that it is predominantly in our community.
It is.
yeah, but it's a community discussion too that we need to have. I mean, I think you'd be a complete idiot to try and run a Just Say No campaign.
Yeah, 'cause they work so well.
But a lot of I think sometimes, clearly the approach should be a harm minimisation approach.
Well, yeah.
But that's not just about how you use the drugs. I mean, you also need to raise questions about what drugs you're using. and how often,
and where and who with.
where and
Yes.
who
I
with.
mean, I actually saw, I picked up at the VOC about a couple of weeks ago a drug pamphlet. I was reading through it and I was thinking, oh, this is a load of rubbish, because it was really sort of saying, oh, drugs are really bad and it'll send you mad and things like this. And I'm thinking, we as a community seem to have this perception that somehow drugs are bad, and yet we obviously, there's a lot of people out there who take them, obviously, because I know the ATO is very interested in trying to put a GST onto it because there's so much money can be generated.
No, that's just silly.
We seem to, I think as a community, we don't seem to have matured enough to say it's not the drugs themselves that are the problem per se, but how we use them and what context and what settings that we use them. I don't think we've actually moved on to that side of the discussion.
It's also the quantity. Like, I mean, I don't think anyone can seriously argue that doing ECI every weekend is a good idea for your health. But at the same time, I think you'd be a complete idiot and have no credibility if you stood up and said never use ECI. I mean, so it's getting the right approach. But it's about having a maturer discussion in the community, because some people are really stuffing up their lives and their health with drugs, and I suspect there's not enough support coming from within the community to help people deal with that.
And the person who always says don't do it's always got a Scotch and Coke in their hand or something, you know, one drug and a cigarette, you know, telling someone else not to use this drug.
Exactly.
Absolutely, and drugs, when you talk about drugs, I mean, alcohol and nicotine are still the two biggest problems.
That's right.
Particularly some of the research around levels of smoking amongst lesbians is really high.
Really?
Yep.
Lesbians
It's
and
higher
cigarettes?
for the whole queer community, but it's particularly high amongst the lesbian
You listing on
community.
camera there?
What about lesbians and cigarettes? There you go.
Don't know.
Now, just before we go to Midsumma, I just wanted to mention law reform just quickly.
Yeah, I mean, large part of the law reform issues that deal with health have been addressed with the passing of the same-sex relationships bill. Before that, for example, no one had a right to have access to their partner in hospital. But that stuff's been addressed, but there are still some other issues around law reform which affect health. And the most obvious one is the issue relating to reproductive technology and screening of sperm for lesbians. And we've recommended that be referred to the Law Reform Commission.
What about transgender issues? I noticed this week the British Parliament passed a bill allowing them to marry, change birth certificates, etc., etc. Were there any recommendations along that line?
Yep, we've recommended that the government consider the laws relating to the change of birth certificates for transgender people as well. Yeah. So that's one of the recommendations in the report.
Wow.
Because that can often be, for someone who doesn't necessarily feel they have to explain their situation, when you're going for official documents or anything these days, it can be a problem.
Yeah. As you can see, the action plan has heaps and heaps and heaps of stuff. We could probably do a whole series of shows. We should talk about something else.
Boy, your
but,
viewers senseless.
No, it's that's the thing. Other people get cranky if we don't talk about Midsumma. We need to promote a bit of Midsumma. So Midsumma's happening again, despite what you may have heard. The street party. Street party is gone, isn't it?
Street party was cancelled.
Cancelled. Insurance.
Yeah, I can't believe it. It's just.
Well, I think their total bill, even without the street party, is something like 60k.
No, it's 85 was the total insurance bill.
And now it's only 60.
Oh, who knows?
It's
I don't know what
a
it is.
huge amount.
It's a lot of money.
Yeah.
It's
so-
a huge increase. But I think sometimes with this insurance debate that's going on at the moment, we seem to forget that there are certain companies keeping insurance levels low, like HIH, because they're just being unsustainable. And all that's happened really is there's just a reassessment of what it should have been, except the increase has just happened in 1 year instead of over a 10-year period.
I heard them say it actually the other day, like after the bushfires in New South Wales and everything, and a lot of people, it turns out, aren't actually insured.
Oh, really?
And they're saying that the cost of insurance is related to the number of people who take out insurance too. So if more people took out insurance, insurance would be cheaper. But because only say half the population do, they're covering the other half, if you know what I mean.
Yeah. It's all a bit too late for Midsumma Street Party, isn't it, unfortunately? But what else is happening? Is there
It's
controversy.
actually
Bit of
quite a lot,
controversy.
actually.
Yeah, because, you know, the north side and south side venue owners are sort of really... And there was a letter in, I think it was MCV or B News the other week, from someone who went to the Midsumma crisis meeting a couple of weeks ago and noted that not one commercial road trader was actually there at the meeting on the day. So a few other traders from the north side have jumped in and said, we would have, we would have sponsored it. We'll look at next year and see if we can't get something going. And commercial road traders have volleyed back with, well.
Oh, it's just like politics, isn't it? Like, trying to beat each other.
Well, I think at the end of the day, as a community, we have to we either support these events or we don't.
Exactly.
And if we don't want to support them, let's just say so.
But it's not just a matter of volunteers like here at Ben TV supporting. Say it's up to the businesses, it's up to the community
it's part
groups.
of the community.
Yeah, it's not up to the one volunteer here and there to keep the thing going.
Well, no. I mean, as much as you want to do it. But the Midsumma Carnival is still on, and that's the date you said. The date
9th of Feb, I think.
Yeah, but that's not definite though.
It's not definite though.
No.
Well, they sent out a flyer to me this week and it said the 9th of Feb, so I'm sticking with it.
So if it's going ahead,
It's my understanding that Midsumma has cancelled street parties so they can focus their resources on Carnival, but doesn't mean that Carnival will
It's
still go
definitely
ahead.
on.
They're still going to find
I
$60,000.
see.
for
So they're still going to get this 60 grand before that'll even happen.
but all the cultural stuff is
All
happening.
the cultural stuff's happening. I think that's all sort of under
Yeah,
an
so there you
umbrella
go.
of
Yeah,
other
we'll try
things.
and get our cameras out there and film a couple of things
That's right.
and put it to air during
But
summer.
The guide's available. I think I picked this up at Hares and Hyenas, so
So check it
it's
out.
available. And it just seems quite a good few things in there. I know just Kay Sarah is sort of getting her face in a
Plastered.
few programs, plastered a few things, and
And there's always physique competition, always very popular.
Conversations. Yeah.
but there's also some other interesting things, like there's the log cabin Republican dinner. I thought was a bit odd.
Log-
The
Oh,
log cabin
that's it, an
Republicans are
Very old gay group, isn't it?
no, not
No?
no? Well, it's the
Republicans in the
Republican
US,
Party, which
the
is
Conservative Party.
which is like the Liberal Party here.
Oh, there you go. They're not gay then.
They have a gay section.
Oh, there you
and,
go. That's right.
So they bring out one of the guys out here to have a chat about it. So
Oh, that'd be interesting.
yeah, I never quite understand the concept, but
No, but it'd be good to see.
yeah, I thought it'd be interesting to go along and see what they actually say.
I reckon so.
There's some other things on. Peter Tatchell's back again. That should be fun.
Oh, and by the by, also Foundation are looking for volunteers for the upcoming Red Raw 03
Yep, Red Raw is happening.
party. They need something like 500 people.
Volunteers.
To volunteer. Yeah, well, I mean, that's everything.
Wow.
That's sets, that's, not just on the night sort of
Cloak
stuff.
room.
Background, yeah, done that, been there.
Yes.
It was a long night.
Yes, don't think it's going to be an
It's
easy
not easy,
night.
believe me.
7 o'clock in the morning, nothing scarier than cloak room. But go ahead and volunteer.
And that
You
goes
don't
back
need
to
it.
all those people taking drugs. You see them leaving at 7 in the morning. It's quite scary.
Very unattractive. Yes. And
So if you want to do that, actually, I've got something here. Call 9827 4999 or also at also.org.au if you'd like to volunteer for that.
we have to mention Moist.
Yes.
Wet on Wellington.
Yes, the ladies' night every third Monday of the
every
month,
month.
so it's just happened this Monday gone. That's also an Also Foundation fundraiser,
Oh, is
but
it?
it's a ladies' only night.
There you go. So look, see.
$18 concession if you're an Also member.
There you go. So all you dykes out there, go and support it because I know a few dykes out there who say we're out on sex on sex venues.
Yes.
There you go.
Now you got one. So
Yes. It's only one night a month, but if it picks up,
Apparently it's been quite successful.
yeah, it's been
where do
huge.
they put the tower?
I don't think I want to go there, actually.
We'll have to ask. Have you been yet? You have been. Was it a good night?
Yeah.
I'm talking to our camera
camera
person.
person's gone.
Was it a good night?
Very good.
Because they only had the one initially, and it actually took off, and all the word of mouth and everything. So they brought it back as a monthly event.
Yeah.
It's been big. So yeah, go and check it out. Moist. Wet on Wellington. Okay, now we've got to wrap up. Already.
Really?
It went very quickly. So, Tony, thank you very much for coming on
Indeed.
and talking about
Thanks,
the
Tony.
health action plan, and hopefully it'll all go to plan and everything will
Hope
happen
so.
and life will become a lot easier. So, thank you for joining us, and remember our new time slot. Don't tune in on Monday. I can't talk. Don't tune in on Mondays anymore.
Thursdays. See you then.